So now the non-gas producers gram-negative bacilli. In this we have Shigella. We have known that Shigella is gram-negative bacilli, non-lactose fermenter, non-oxidase, and also it is non-gas producer. So Shigella. First, I'll give a summary, a story regarding this Shigella. There is a 4F respector at a fecal matter. There is the flies and also the food and the finger. If a person is traveling to an area where the fecal matter has poor sanitation system, and there is a poor pest control or the poor fly control. There is a poor hygiene, and also the poor quality services, quality control of the food, poor quality control of the food. So Shigella is transmitted by human reservoir like Salmonella typhi reservoir. So infected human fecal matter is exposed in the environment. Now the flies goes, if the sanitation system is poor, the fecal matter is not treated, the flies goes on that fecal matter, and they bring a lot of salmonella pathogens with themselves, and these flies go on the stall food, especially those food in which there is a poor quality measures, that food. Now that food is infected. So if a person has a poor hygiene, no hand washing practice, then he ingests those exposed food on the stalls. So the food goes from the bacteria, from the stall into the human stomach. In the stomach, as we know that the Shigella is acid resistant, so there is no effect on the stomach acid on this Shigella. So the infectious dose is very much low, that only a small number of Shigella pathogen can cause bacillary dysentery. There are four different strains, four different type of Shigella. There is dysentery, flexneri, boydii, and also Sunnae. And Sunnae, the least toxic, is very much common in the US, despite the best sanitation, best control, best quality measure, and best hygiene. The least severe, the least dangerous form of Shigella is causing diarrhea, which leads to the complication is reactive arthritis. The reason why I keep insisting on reactive arthritis, that in the patient setting, in the OPD settings, we only see those patients which are reactive arthritis, or which are having a painful joint and muscle pain, and then we dig in the history of the patient. Then the patient told you about that he has a 1 week or 2 week trip regarding trip to any endemic area where the sanitation system is not good, or like Southeast Asia, Thailand, etc. And after returning from that trip, now he first he is suffering from some kind of diarrheal condition, and now he is suffering from painful joint pain. Then we came to know about the importance of that Shigella, that the reason behind this reactive arthritis presentation is Shigella, or there is a poor sanitation system. So the chain comes from the root cause is that sanitation, that quality measure, that hygiene measure, that leads to reactive arthritis, and now the patient is very much in a debilitating condition. So this is why, that is why I am very much focusing on the reactive arthritis condition. So after going from the stomach into the intestines, now the Shigella, like Salmonella, it invades into the microfold, pyre patches cells. In the cell, it evade phagosomal activity or phagocytic activity by it has a toxin, Shigella toxin, which inhibits 60S of the ribosome, leads to cell death, necrosis and cell death. And it is pretty much invasive type of pathogen. Means invasive means it is invasive type of pathogen. It goes into the cells, evade phagosome. Now the patient has a presentation of first cramps, then tenesmus, then bloody mucoid diarrhea, also known as bacillary dysentery. And after a few weeks or few months of diarrhea, there is a reactive arthritis condition. So there is no vaccination for this, no vaccine in order to cope up with this Shigella. Only the preventive measures are very much effective and antibiotics are very much effective against this Shigella toxin. So it has actin polymerization in order to spread from cell to cell in the body. And also when we do biopsy of that intestinal part, we will find polymorphic neutrophils infiltrate. So this is a brief summary for Shigella, non-gas producer pathogen. After Shigella, we have Yersinia. Again, recall, Yersinia is gram negative, Yersinia is lactose negative, Yersinia is oxidase negative, Yersinia is non-hydrogen sulfide producing pathogen. So Yersinia is very much pleomorphic, bacilli, maybe cocci, maybe cocobacilli, whatever. On bipolar staining, bipolar staining, we have a clue for safety pin like appearance. And Yersinia has two varieties. First one is enterocolitis and second one is pestis. Pestis is very much unique. Pestis can cause plague, and it is from the rodents like the mice and the prairie dogs. These are the clues. And in the prairie dogs, we have the flea as a vector. So the flea infecting, sucking blood from the infected rodents, and then it infect the human, and it can causes pestis type of Yersinia. And it is very acute febrile illness leading to regional lymphadenopathy called the BUPS. So this is a brief summary of the pestis. Now the enterocolitis, it is intracellular pathogen. Entero and colitis, inflammation of the colitis, it can cause acute bloody diarrhea. Also it can cause pseudo appendicitis, which mean that there is a mesenteric adenitis, inflammation of the lymph nodes of the Peyer's patches. And also there is a terminal ileitis. Transmission is very much transmission from the infected pet fecal matter, a route of transmission. And also infected milk and pork. And Yersinia is also one of the causes, or one of the etiological causes of reactive arthritis. So this is all about Yersinia, Shigella, Salmonella and Proteus.